So this is a young girl who came in with a history of prolonged fever, had been seen for the fever, and it was thought to be a viral infection. She developed a rash. She had a throat culture that was positive for group A strep, so they thought it might be a strep infection and was treated for that, but the fevers never went away. And then she started being less responsive and more confused, and that was when she came into the emergency department and then came to see us. It's not common in Indiana. In the other places where I've practiced, which is Michigan, Ohio, and Minnesota, it's also very uncommon. If you go further south and east, it's much more common. So it depends on where you are, how common it is. It's not very common in Indiana. The reasons to be concerned or to have a highlighted awareness of the possibility of it is if you've been outdoors where you know there might be ticks, because it's a tick-borne illness. So with this particular infection, the bacteria gets into your blood and it starts spreading, and sometime after it starts spreading, you get symptoms, and usually the first symptom is fever. So you'll get a fever and then often, but not always, a rash. And the rash has a characteristic appearance most of the time, but not all of the time, which is that it starts at your wrists and ankles and then moves inward. Unfortunately, that doesn't happen all the time, and so we can't rely upon that, but if it happens, it's something to be concerned about. And then after the rash, you may get, after or before the rash, you may get symptoms like nausea, vomiting, headaches, muscle aches, kind of non-specific symptoms, but feeling worse and worse or sicker and sicker with the illness. And if it goes on to become more severe, you can get really bad respiratory distress, you can get problems with thinking and maybe even not responding if it reaches your brain. So that's getting to the end stages when it gets more severe. So they should see a doctor to see what the doctor thinks about the fever and the rash. In peds infectious disease, fever and rash is the main thing we see. There are many, many infections that can cause fevers and rashes. So the doctor needs to look and see, is this something else that's very common that causes a fever and a rash, and evaluate for that, or based on where the child may have been and what the rash looks like and the other symptoms and their physical exam, are they worried about this, what is in Indiana relatively unusual diagnosis of Rocky Mountain spotted fever. It has a variable timeline, so the longer you wait before getting treatment, or the longer it is before you get treatment, the worse your outcome may be. So it can take quite a while, but the longer out it goes, the more you may have a bad outcome. So because fevers in children are a very common thing, I would say the things to look out for are, has the kid been outdoors? Is it an area where there are known ticks? And are there any of these other symptoms that go along with it, particularly the rash, but also kind of nausea and vomiting or muscle aches or headache that aren't getting better? And if those things are present, I would say almost regardless, there are other things that cause this can be bad too, that they should see a doctor and be evaluated for that. People that have the worst outcomes are young children. It's actually between the ages of 5 and 9, not the youngest or the oldest, but young children in general are a bit at more risk for worse symptoms, and then older people, so above the age of 50. But most people who get it are not immunocompromised, they haven't got other health problems, so this can happen to otherwise healthy kids and adults. It's not easy to diagnose, so if you are worried about the diagnosis, you start treatment straight away. In a child that comes in really sick, we don't wait. If we have any suspicion this might be it, we start treatment, and treatment was with a drug called doxycycline. And doxycycline has historically not been used very much in kids under 8 because if you use it for a long time, it leads to teeth staining. But this is a medical emergency. We use it always. It's the best drug. Really, for young children, it's the only drug we can use. So you get them on doxycycline while you're waiting to figure out what's going on. Then you can do a bunch of tests to see whether it's something else. The tests for Rocky Mountain spotted fever are antibody tests mostly, and those tests take a while to get back, so you're not going to get them while you're waiting to decide to treat the child. You can also do a PCR from the blood. It isn't always positive in kids who have this disease, but if it's positive, then you know that's what it is. So that's another kind of specialized test you can do. So the drug largely works on the bacteria. It gets rid of the bacteria, and these bacteria are very special subclass. They're called rickettsial bacteria, and so they are not susceptible to most of the antibiotics that we use. That's why doxycycline is such a special class, because it works on mechanisms that bacteria uses to create disease. So it can get in there and kill the bacteria, where your standard antibiotics won't do that. It had actually been quite a while, but then she had had symptoms for several days by the time she got into the hospital. So I think the time we went over this with them many, many times. I think the time between when she was camping and when she first had symptoms was about 10 days, and the incubation period is about 2 to 14 days. So variable, but that's about right. You know, she was seen twice before she came here, so I think the family was very aggressive about trying to find out what's going on. And I'll also say that this is not easy to diagnose if it's not an area that has a lot of it, because if you think about it, fever and rash occur in so many children for so many different reasons. Her rash didn't necessarily present with the classic pattern I described before. So it is really easy when you have an alternative diagnosis to treat the alternative diagnosis. And I think that's what happened here. I did immediately suspect it because it was that and some lab values that she had and some other things on her exam put it together as a fairly classic case, but we haven't seen that much in Indiana, so I think it was tough to suspect earlier on. And there are certainly other things that could have caused it, but that was the top thing on our suspicion list. You should always treat it. As soon as we saw her, we put her on doxycycline. But the longer you wait, the less likely patients are to respond to treatment. So I think it is tough to know if treatment made any difference at all in this case, because she had come in a pretty advanced state of disease. Yeah, so the first thing is to look for ticks themselves. And if you see them, get them off with a pair of tweezers. So you go around the forehead and you pull off so you're not squeezing the tick. But if you don't see a tick, all you may see is a little spot, or you may not even see anything. These ticks are quite small, and the tick itself can be missed, and the bite certainly can be missed. It might look like nothing more than a little scratch or almost nothing at all. It's a lot less common here than it is in states that are to the south and to the east of us. So it's not a common diagnosis here, but clearly it does occur here. And so I think, and it's not the only tick-borne illness we have. There are others that occur in Indiana, including Lyme disease. So I think for people that are going out to wooded areas or areas where they know there are ticks, wearing long sleeve clothing, using insect repellent that has DEET or picaridin in it that we know is effective, staying away from areas that are more likely to be tick infected, like grassy areas or very bushy areas. All those things will help to decrease the risk. Yeah, I mean, it's really important because they actually were very aggressive. I mean, this kid was seen in 2 ERs before the kid came to see us. And you want to be calm because there will be hysteria. But we all don't want this to happen again. So we do want people